Welcome, my dear undergraduate students who are exam going. Right now, we are dealing with the infectious diseases. And what are the infectious diseases? You people will have to know what is given over here. Typhoid. As I told you, any lesion that has got a pathological morphology, gross or microscopy, is a question in pathology. Typhoid is one such thing. So what will happen in typhoid is you find that there can be the beautiful pathogenesis I have explained. This is exactly the diagram that you people will be finding in my tips book. So caused by Salmonella typhi or sometimes paratyphi, where it is getting lodged, pairs, patches, how they are being involved. And after the liver, there is again a re-exposure. You can get what is called a Schwartzman phenomenon causing a necrosis. Finally, you get a typhoid ulcer. Long axis parallel to the long axis of the bowel. So morphology you people will have to mention. When it spreads to the other organs, including the liver, heart, etc., you will be getting a typhoid nodule, accumulation of macrophages. So etiopathogenesis means the poor hygiene, etc., you people will have to mention. 5 Fs I would have given. Fluid, food, flies, fomites, that is clothes, fingers, feces. All these things are there in the etiopathogenesis. And what are the lesions? Mainly the ulcers you'll have to mention and the typhoid nodule. And the clinical picture will be, there will be 3 weeks. You find that there is a step ladder pattern and it falls finally by lysis. So that one you people will have to mention. Relapse can be there. Some people can be carriers. These are all additional points. The complications can be, there can be perforation, there can be extra-intestinal spread. These things find out and whether you people can write. Coming to the investigations, important things will be blood culture. Next is the Vidal test. It is a university question in microbiology also. Therefore, you people should know. Feces culture and urine culture. So these are all the important things and these are my references. And the basic Bible will be your book. Tips is good, R.A.T.S is very good, the class, and Robbins. And courtesy Richens for this particular picture. The next one, the stalwart of pathology, leprosy, or the Hansen's disease. So you people know the questions. I want you to write it elaborately, not just 1 or 2 lines. The classification of leprosy is extremely important. This kind of one I would have given in my books. I would like you people to kindly mention. Indeterminate Hansen's, tuberculoid, and lepromatous. And in between, you will be having the borderline. And what are the various reactions you people can get? So there is a paucibacillary, scanty bacterial content, and multibacillary, where there will be numerous bacteria. And what are all the responses in a case of leprosy, you people will have to mention. Histology is definitely important. You people will have to describe 2 only. One is tuberculoid, the other is lepromatous. In tuberculoid, you get non-caseating granuloma deep in the dermis, close to the adnexus. That is why there will be the loss of hair and other things. Sometimes it can lead to a abscess, a nerve abscess, or sometimes a pyelonephritis also. So these things you will have to mention with the diagram. Lepromatous leprosy, classical one. Flattening of the epidermis, presence of Gren zone, foamy macrophages in sheets, lack of adnexae, all are given. And what is the basic immunology of leprosy and the reactions? These are questions for you in microbiology and pathology. If you don't read leprosy, you are taking the risk for 2 subjects. And these are again my references. The stains will be Waite-White Farrago stain, usually asked as a question for us. So I would like you people to mention all this, including the classification. And the clinical picture can be, there can be hypostatic or anesthetic patches, thickening of the nerves, and in lepromatous leprosy, there is a leonine phases, collapse of the bridge of nose. All have been given very detailed in my book also. But the histological picture, kindly go to my R.A.T.S class. It has been described in detail. That volume I need in the answers. And my dear students, we should be extremely careful about some short notes also. On the screen, I am finding a tangled mass of filaments. And in the slide, it will be covered by a pinkish material, and that is called the splendor Hoplite phenomenon. Courtesy allow me for this beautiful picture. The diagnosis will be actinomycosis, which I shall be explaining in spotters also. We will have to mention what are all the sites. It can be cervicofacial, it can be thoracic, it can be abdominal. What can be the predisposing conditions? And clinically, you will be finding discharge of sulfur granules. The differential diagnosis will be hyphae, which are broad and short, as in the case of meganomycosis, but that will be occurring in the extremities, particularly the leg. So these things you people should be knowing. Again, opportunistic fungi can be a very rare question or can come in MCQs. That can be aspergillus, which have got slender branching hyphae at acute angles, which are septate, or it can be mucor with broad aseptate hyphae. These are extremely important in immunosuppression, particularly with this COVID-19. We have had many cases like that, or in diabetes, or with administration of steroids. They are called as opportunistic fungi because at the correct opportune moment, they will thrive. Candida albicans is also one. You should know a list of it. Kindly find it from your book. Last but not the least, it has been asked in the exam also, rhinosporidiosis. Already you have seen a slide of rhinosporidiosis, sporangium with endospores. So the swimming pools will be the source of contamination common in countries like India, Sri Lanka, etc. Kindly go through that one for the sake of completion, and that brings us to the end of infectious diseases. Thank you.